Welcome to the Art of Client Services Disclosure course, Disclosure of Adverse Events. Please note that the information provided here is generic in nature. Each CCAC and service provider will have specific organizational policies and procedures related to disclosure. Learners are reminded that these training materials are designed to support the implementation of local practice, and local policies and procedures must be reviewed in conjunction with this module. Upon completion of this module, the learner will describe organizational policies and procedures for disclosing adverse events to clients and their families, and they will implement organizational policies and procedures for disclosing adverse events appropriate to their role in the adverse event and their management role as per their organizational policies and procedures related to disclosure. Disclosure of an adverse or harmful event to a client, the family, or substitute decision maker is a process that requires consideration of the client's personal, social, religious, and cultural needs. Each organization will have disclosure policies and procedures. Learners are encouraged to review their organization's disclosure policies and procedures in conjunction with this module. The following client story is based upon an actual client, and with the permission of the client's family, the client story has been adapted for training purposes. Client identifiers have been removed and modifications to the story have been made to protect the privacy of the family. The value of obtaining the opinions of patients and healthcare clients has long been recognized. However, this feedback has largely focused on measuring patient satisfaction with their care. More recently, the benefits of seeking an understanding of clients' experiences in healthcare and taking action as a result of such knowledge is increasingly seen as a powerful way to improve care. The disclosure process involved various care team members. The following videos provide highlights of the disclosure process that occurred after the premature death of a chronic palliative client. Learners are encouraged to take notes as the physician, the family, the service provider agency, and the CCAC were all involved in the disclosure process.
The story you're about to hear is based on my patient. As a physician, I contacted the CCAC after my patient's death. The benefits of understanding clients' experiences in their healthcare and taking action as a result of such knowledge is a powerful way to improve care. Client stories bring experiences to life and are insightful, as an individual story is not in itself representative of all client experiences. However, each one is valid and can help us build a picture of what it's like to be a user of the organization's services. The purpose of this true client story is to understand the client and the family's experience with healthcare services and look for opportunities for system improvement across organizations. This chronic palliative care client faced many challenges with his care over time, leading to a series of adverse events, resulting in his premature death. To honor the memory of their son, husband, and father, the family agreed to share this story for the purpose of providing training and education to CCACs and contact staff so that others can learn from these events. This complex story helps to illustrate the importance of all members of the healthcare team, both internal and external, being involved in the investigation to prepare for the disclosure meeting. In addition to CCAC staff, this could include contract staff, hospital staff, physicians, pharmacists, and others involved in providing services to the client and his family. Acknowledging and apologizing for the suffering of the client and caregivers resulting from the adverse events is an important goal of the disclosure process. We start by listening to the story relayed by the client's mother, who played a major role as a caregiver, supporting the client, her son, and his family.
My son was a 53-year-old male diagnosed with adenocystic carcinoma of the jaw. He had been diagnosed with the same cancer 20 years ago and responded well to radiation and surgery until its recurrence. He lived with his spouse in a 2-story house and previously worked as a professional, but was on disability as a result of the cancer recurrence. My poor daughter-in-law worked and had to travel frequently on business. My granddaughter was nearby, but my husband and I stayed with our son Monday to Friday to provide supervision and support to him while our daughter-in-law was working. During his care with the CCAC, our son's appetite was fair, but he was unable to eat solid food due to decreased function of the jaw, and therefore intake was limited to liquids or fine pureed food. He had undergone 2 surgeries to remove teeth as he had difficulty performing oral hygiene activities, and he had a tube inserted into his stomach, which helped with medication administration and supplemental feeds. He also had difficulty with his speech due to the immobility of his jaw. And during his independence, my son, the whole time he was ill, he just wanted to maintain his independence. So he participated as much as he could in his care. He was living on the main floor of the home, and as he had difficulty with stairs, he would fall, and he had a resulting hip fracture, which occurred 4 months prior to his death. My son and his wife were unsure of his prognosis, and since he could not tolerate chemo, no further treatment was planned. On average, my son reported that his pain level was about a 5 to 6 out of 10, but he had an increased incidence of headaches. His father and I initiated CCAC care, but he passed away approximately 2 years after the CCAC services had started.
In my role as a CCAC Senior Director of Performance Management and Accountability, I received an email from a palliative care physician detailing his concerns regarding CCAC care of one of his patients. The care appeared to be less than outstanding, but the client had not been identified in the email. As the client was recently deceased, it was a poor time to initiate contact with the client's family. However, we asked the physician to request from the family that the client be identified so that we could follow up with the identified concerns. Following a review of the client's record, it was felt that an informal review of this client's experience and care was required. A formal review was initiated with all parties involved in the client's care, including the CCAC and the service provider. We also suggested to the physician that we would be interested in speaking directly with the family at a time that they felt able. Approximately 1 month after the initial contact with the physician, the client's mother spoke to me, providing details of her concerns. In addition, she had written a letter outlining her concerns and would forward it to me following our discussion. She stressed that her main purpose was to ensure that others did not receive the poor care experienced by her son.
Don't get me wrong, we appreciated all the services that were provided through the CCAC, but we often were frustrated because as my son's condition began to worsen, we tried to bring his frequent falls and increasing pain to the attention of the nurses and the case manager, but there were so many nurses visiting. I did not think they really understood how his condition was declining and how his pain was affecting him. He was having difficulty with feeding and nutrition and all of those falls. It was so hard for us to explain this to different nurses. They couldn't see the progression of what we were going through. We felt like we were going in circles. My son couldn't talk, so we had to speak for him. The nurses were telling us to call the doctor, and then when we called the doctor, he said to call the CCAC. We called the CCAC case manager, and she told us to call the nursing agency.
The disclosure process involved numerous care team members, not only from a CCAC, but also contract staff from a service provider organization and other community care healthcare partners. We begin by hearing the preparations for the disclosure process.
The objective of this case review was to identify the issues, contributing factors, root causes, and opportunities for improvements to the system. Of quality and risk, I conducted an initial review of Client C's case and discovered a number of issues. First, there was inconsistency of scheduling nursing services. The family requested a consistent nurse with time-specific visits, and this was not happening, creating frustration for the family. The case manager documented a missed visit, but there was no follow-up. The service provider noted that cases reviews were not undertaken with the client and felt that they were not consistently completed across all the CCAC branches. On one occasion, Client C was left with no feeding supplies, and thus his feeds could not be completed. The supplies that were ordered were not the same as Client C used prior to being readmitted to hospital. It was determined that the discharge notes indicated the incorrect supplies, and thus the order was not processed correctly. There were a number of issues that the case manager service provider had discovered on their review.
As the manager of the service provider agency, when we prepared for the disclosure process and investigated, we found that CCAC was not receiving communication from nurses and that new nurses were not aware of the policies around communicating with the CCAC. Nurses thought that they could leave a message on voicemail and didn't record the details in the client's chart, so it was hard to track what actually occurred. We found that some of the nurses did not report Client C's palliative performance scale number on a consistent basis to the case manager. Communication was not getting to the right person at the CCAC, and as a result, Client C's quick deterioration was not identified as early in his care as it could have been. The exact same thing was occurring about the client's falls. Again, it was difficult to trace what the communication had been until we tracked this during an audit of the communication process, but sure enough, Client C's falls were not consistently reported to the case manager. Voicemails were being left, but it was unclear in the client's chart where the messages were left. The nurses should have spoken directly with the client's case manager to relay this important information about the client's deteriorating health status and the frequent falls. Changes to his service plan may have prevented him from falling and fracturing his hip. When the client was discharged from the hospital, he was referred to another nursing agency and we were no longer involved. The other agency reported that Client C preferred a certain nurse, and if the person was different, then he would not answer the door. The client found it very stressful when new nurses came, and he felt he had to explain everything to the nurse. He had lost trust in the nurses and was very fearful about his condition.
I am Client C's case manager. As part of the disclosure process, when I reviewed the client record during the time the client was on service, there was a lengthy delay awaiting a wound care consultation. Client C was deteriorating quickly, and the family felt very anxious that his wound was not being addressed appropriately. The client was very stressed by the lack of communication and confusion about ordering the wound care mattress and responsibility for following up on the wound. There was also a failure to pick up medical equipment in a timely manner following the death of the client. The day following the Client C's death, the family had asked that the medical equipment be picked up as soon as possible, as it was upsetting them. Unfortunately, the equipment was removed from the home a week later.
Here's a list of the improvements that resulted from the review and disclosure of this case. The service provider agency implemented a new master rotation schedule, which included aligning staffing requirements to improve continuity of care. The service provider agency retrained designated nursing staff, on palliative assessment skills, documentation, and communication with the CCAC. All nursing agencies and the CCAC developed a guideline assisting frontline nursing staff to know how to communicate with the CCAC case manager, such as when to speak to a case manager and when to leave a voicemail and where to leave messages. The CCAC has followed up with the equipment supplier to discuss response time for picking up equipment following the death of a client in the home. A new contract for medical supplies was put in place with improved delivery requirements. The CCAC has reviewed the process for ordering supplies with staff. The CCAC also placed a master service provider contact list on the CCAC intranet. The list has the name of the key contact at each agency responsible for scheduling issues. The CCAC defined the process for conducting case reviews so that the CCAC staff and service providers consistently understand various types of case reviews. The CCAC also re-educated their staff on the consent and documentation standards, as well as power of attorney. We reviewed at the service provider meetings the types of falls which should be reported, how to report them, and when it should be classified as an adverse event. The CCAC educators trained staff on ensuring the continuity of service providers as documented in CRIS. CCAC established a wound care prioritization triage system with detailed criteria. CCAC and the service provider staff were educated on the importance of the enterostomal therapist nurse and referral to the enterostomal therapist nurse when appropriate. CCAC also implemented a mechanism to alert appropriate CCAC managers on high-risk wound care events. I knew that the purpose of disclosing was to affirm clients are entitled to be informed of all aspects of their healthcare, including the right to disclosure of harm that may have occurred during the course of receiving healthcare. This facilitates their active involvement and decision-making in their ongoing healthcare. It also ensures that clients will receive prompt and thorough interventions for any harm suffered or anticipated. Disclosure ensures that clients and families will receive important information about their care in a timely manner and provides opportunities to learn how to improve the quality of care and improve client safety practices, processes, and systems of healthcare delivery through management of adverse events. Disclosure provides guidance and support to employees on the task of disclosing adverse events. Prevents dissatisfaction with care through timely and open response to adverse events by trusted and responsible personnel. Strengthens the relationship between the CCAC staff members and the client or family by fostering open, honest, and ongoing communication and improving the disclosure process. Support learning and quality improvement from adverse events and near misses through a no blame or just culture. And also, when planning the disclosure, I ensured that I reviewed the event with all appropriate team members, which included contracted staff, and discussed the strategies for disclosure. I also contacted our Director of Quality and Risk Management prior to disclosing the adverse event to review and discuss the action plan and to determine if the insurer should be contacted.
During the disclosure meeting, I was the most responsible person to disclose to the client's family. There were several other individuals at the meeting, which included the service provider. I took the lead during the meeting. First, I apologized and advised the family that I had conducted a number of reviews relating to the harmful events prior to arranging the disclosure meeting with them. We met with the family and disclosed the events that led up to the adverse events, and I allowed time for the family to ask questions. I apologized for their experience and the events that happened to their loved one. I reviewed with the family that we learned a lot from this adverse event, specifically the opportunities of how to improve the system to ensure that other clients do not have to go through the same experience. I provided the family with all the contact numbers and advised them that they could contact me should they have any further questions at any time.
Both the service provider and CCA staff felt this case review and the disclosure with the family were extremely positive. It was a collaborative team approach resulting in recommendations for improvement. Members felt that they were able to be open and honest during the discussion with the family, and no one was blamed.
Meet with us, even though it was after our son's death. Nothing can replace the lost opportunities for us to spend more quality time with our son in the last months of his life. But we decided to share this story with you, and we're comforted to know that his suffering will make a real difference, and how others, like our son, are cared for in the future.
The disclosure process includes an acknowledgement of the adverse event and the harm to the client, an expression of regret or sorrow, care and support for the clients and the healthcare providers involved in the adverse event, and system improvement and integrated risk management. In conclusion, involving patients and families appropriately to share stories and put a human face on safety and quality issues can help change the culture at an organization away from shame and blame towards open discussion and learning from quality and safety issues. We are committed to a just culture in which client and staff rights are respected. We acknowledge adverse or harmful events to the client and apologize appropriately. Care and support to clients and healthcare providers that are involved in the adverse or harmful event is part of an integrated risk management approach to system improvements. In the case of Client C, the disclosure process was completed following the death of the client. The client's family were an integral part of the disclosure process with the healthcare team. System improvements that were made following the disclosure process resulted in improved client and staff experiences. As part of this module, learners are expected to review their internal organizational policies and procedures and reflect on how they would respond to a similar scenario.